And welcome to the Dr. Bob Show. Do you know what the symptoms of a heart attack are like? We'll be talking about those symptoms and how to recognize it and how important that is. Do you know that women can have the very same symptoms as men, but they may have some different symptoms that are very different while they have a heart attack? And it's important. Do you know what those symptoms are? Do you know how vague they can be? Do you know how it can be important to save your life? We'll be answering those questions on the show. My guest is Dr. Janet Eichholz. Dr. Eichholz is a board-certified cardiologist. She deals with heart problems every single day. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about a new medication for women that have depression after pregnancy. And we'll also be talking about the side effects of a blood sugar that's too high or a blood sugar that's too low. Different symptoms, different things to be looking for. A lot of information for you. We're talking with Dr. Janet Eichholz, board-certified cardiologist, and we're going to be talking about women, heart disease, heart attacks in women, different than men. Janet, welcome to the Dr. Bob Show.
Thank you for having me.
Are there differences in men and women in the symptoms that they have of a heart attack?
Well, men and women still usually both have chest pain. That's the predominant symptom. But compared to men, women may have more atypical or vague symptoms.
So men are easy to pick out. Women sometimes it's a little bit more difficult.
Exactly.
Is it they're more sensitive, or they just got different? It really makes it more difficult for the doctor to pick up that somebody's having a heart attack.
Yeah, so women do have these atypical symptoms that weren't traditionally taught to physicians, because we really didn't know, over 30 years ago that women had different symptoms. So it's been a learning process for everybody. But women do have these vague symptoms that you might think might be due to something else, but in fact, it could very well be a heart attack.
So what are some of the vague symptoms that women have that men don't have? And then we'll talk about what they both have. What are the vague symptoms?
So, typical symptoms is crushing substernal chest pain. But women may have more kind of vague chest heaviness, or just pressure, or just a dull ache, a dull sensation. They may only have shortness of breath and no chest discomfort.
Is a shortness of breath something very different? They know something's going on, or is it just a little shortness of breath and they may have had that when they were exercising?
It's different. It's shortness of breath that is different, but maybe they've been having it for some time and they just kind of ignore it because it's not those textbook symptoms.
Yeah, and women are caregivers and they're used to taking care of other people, not themselves. So sometimes they may not listen as well. So shortness of breath. Exactly.
Shortness of breath, fatigue. Unusual fatigue is something that we see.
How much fatigue? What do you mean by unusual?
Not being able to complete, normal tasks.
I'm just too tired to do that.
I'm too tired to do my household chores. I'm too tired to do the laundry. I'm too tired to cook. Something that, a couple of months ago I did easily.
So you really were running around like a little hot rod, and then all of a sudden, I just can't do it. Something's the matter.
Exactly.
Or, can't do it and I'm short of breath. I'm just too tired to do anything. Okay. So we've got the fatigue, we've got the vague chest pain, we've got shortness of breath. Anything else? How about sweating?
So sweating's a tricky one, because a lot of times perimenopausal women will have a lot of sweating, and it's difficult to differentiate that symptom. I think sweating would be important also with these other kind of vague symptoms.
Okay. Any other vague symptoms?
Sometimes palpitations or racing or skipping of the heart.
Can the women feel that? Can they feel the palpitations?
Right, along with some of those other symptoms. So a lot of these things happen together too.
So would the doctor or somebody else or the friends or the husband say, well, you're just a little nervous, honey, you'll be all right?
Exactly.
So you have to be aware of these
Right.
things. Is it easy or difficult, or do they know the women know there's something that could kill them?
So women, I think we're traditionally, when we're brought up by our parents, we're not taught that women have heart attacks and that these are the symptoms that we need to worry about. We're taught by our mothers that we need to be worried about breast cancer. And I think that's where the disconnect is that women need to be taught early on that heart attacks are the #1 cause of death in women, and we need to be aware of these symptoms.
Repeat that again. What is the #1 cause of death in women?
The #1 cause of death in women is cardiovascular disease, predominantly heart attacks, more than all cancers combined.
So we worry about our breast, but really we should be worrying about our heart.
We should be worrying about our heart just as much as we're worried about our breast cancer.
The leading cause of death in women. I just
Yes.
want to repeat that because it's such an important statistic that we
Yes.
have got to get across to men and women. So what is the typical chest pain that men and women can have also?
So kind of crushing substernal chest pain is the typical symptom, radiating to the left arm, to the jaw, associated with nausea or sickness on the stomach, and a clammy sweat.
Yeah, that clammy sweat is really something that sort of gives. Why do they have pain in the shoulder, the jaw, the left arm?
It has to do with how the nerves innervate the heart and where the pain is referred to. And the heart sits kind of in the center left side of the chest. So those are the nerve endings that are affected.
So the same nerve endings that affect the arm affect the heart. And so
Yes.
when you have heart pain, why does the heart have pain during a heart attack? Is it because it's not getting nourishment?
It's not getting blood supply. And so just like when your tissue doesn't get adequate blood supply and it's starved of oxygen, the cells begin to kind of die. And you can have pain from that kind of cell death or lack of blood flow.
So if you're having pain from that lack of blood flow to the heart, or you've got atypical symptoms, is there blood work that's the same that says, yes, you are having a heart attack?
Yes, there's blood work. There's a blood test that checks muscle enzymes specifically that leak from heart muscle that's having a heart attack.
So that's helpful if we recognize the symptoms.
Yes.
How important is it to recognize and get to the emergency room or get to where there's help?
So it is incredibly important that we recognize these symptoms because time is muscle.
So
and
time
that's
is
what we
muscle.
say. So time is muscle. So we know the earlier that you present at the onset of symptoms of a heart attack, the more likely we're able to treat you appropriately, to get the arteries open, to restore blood flow and prevent complications.
So it's time to say, Mayday, Mayday, when you've got the symptoms that you think are a heart attack.
Yes.
When you say fatigue and shortness of breath and I just don't feel good, a lot of times people have those symptoms. Is everybody going to rush to the emergency room? How do you know when to go and when to not?
That's a very difficult question to answer, but most of these women that present this way, they know something's wrong. Something significantly has changed in a short period of time. And so knowing your body, listening to your body, you know, how did I feel a week ago? And gosh, I feel much different this week. It's a dramatic change in the way that they feel.
Is there something you should do when you feel that way? It should be 911, aspirin to the emergency room. What should we do? Should we drive ourselves? Should somebody else drive you? Tell me about that. It's serious talking.
It is. So when there's a dramatic change in your symptoms and you definitely know something is wrong, and you have these constellation of symptoms, certainly calling 911 is the fastest way to get help because you can be triaged appropriately and get help most efficiently.
Yeah, and apparently most of when you 911 and when the emergency vehicle comes, they have ways to communicate with the emergency room to tell them that you're coming.
Yes.
It's probably a heart attack. And they get the electrocardiogram, send it?
Yes, they get the EKG in the ambulance.
Wow.
They're able to call or send the information to the local ER, and that emergency room physician can call the cardiologist on call so that everything is in place to take care of that patient in a timely manner.
Do you think that we can prevent most heart attacks if we started early enough and knew the risk factors?
Prevention is the key.
Prevention is the key, and that's what we're going to be talking about. How can you prevent a heart attack? How can you prevent this occurring? Maybe you can't at all time, but there's certainly a lot of stuff that you can do, and we're going to be talking about that when we come back. You're going to want to stay tuned. We're talking with Dr. Janet Eichholz, board-certified cardiologist. We've been talking about women having different symptoms of men and how important it is that they can recognize it. They know something's going on, usually, but it can be just fatigue, it can be sweats, don't feel good, just short of breath, vague symptoms, but much different than they were 2 weeks ago. So it's very important. They can also have crushing chest pain right in the middle of the chest, the radiation that goes up to the neck and down the left side of the arm. But now we're going to talk about prevention. We can most likely prevent these symptoms from occurring. Tell me about prevention. You said prevention is the key. What do you mean by that?
So cardiovascular disease or heart disease is a very complex disease process. There's just not one thing or one condition that causes heart disease. So there are multiple risk factors for heart disease, and we like to identify those risk factors and modify those risk factors so that we can prevent the development of heart disease.
So what are some of the risk factors that people have? And you said so we can modify it. How do you break down risk factors?
Right. So I like to talk about the risk factors you can control,
Uh-huh.
those modifiable risk factors versus the ones that you cannot control. So the risk factors that you can control, so knowing your numbers, we always talk about knowing your numbers. So high blood pressure, high cholesterol, diabetes, your body mass index, whether or not you smoke. Those are really the 5 big ones that you can focus on, that you can control, that you can modify.
So how does blood pressure lead to a heart attack, and how can you prevent it? What are the important parts of controlling blood pressure?
So blood pressure is a very complex problem, and when the systemic blood pressure is high for long periods of time, the heart has to pump against that blood pressure, and the heart can remodel and can remodel itself to control that blood pressure, and sometimes that remodeling process can change the arteries and lead to blockage formation.
Cholesterol, what does it do?
Well, cholesterol, you have cholesterol that you eat and cholesterol that your liver manages, and for the most part, cholesterol leads to the actual blockage or plaque formation inside of the arteries.
So we can control your cholesterol by?
Cholesterol, you can control it by eating heart-healthy foods, foods low in animal saturated fats. Unfortunately, you can only manage that about 10% through diet alone, and a lot of people need medication, the statin classes of medications, to lower their cholesterol.
So we've got blood pressure, and we've got high cholesterol, or some of the others?
So diabetes, patients at risk for diabetes, meaning that they do not metabolize sugars or glucose appropriately, and they may be a type 1 diabetic, maybe they're born with diabetes, or maybe they're a type 2 diabetic and they develop it as an adult. So knowing your risk for diabetes, knowing your sugar is very important.
I had somebody tell me once that diabetes is a wake-up call. If you've got type 2 diabetes, you really need to get to work on that part so that you'll stay healthy and won't have heart disease.
Right. A lot of us cardiologists still think that diabetes is a heart disease equivalent, meaning that if you have diabetes, your risk of having a heart attack is almost the same as someone that's already been diagnosed with heart disease. Diabetes leads to so many health problems, including heart disease, kidney problems, strokes, peripheral arterial disease, so it's a very important diagnosis to be aware of.
Smoking?
Smoking. There's not a Smoking is bad for so many reasons, but the tobacco is very irritating to the lining of blood vessels and can contribute to blockage or plaque formation, and can irritate any blockage that you have and cause a heart attack to happen. So any tobacco or nicotine containing product is very damaging to your arteries.
How do you tell people to stop smoking?
I tell people they have to make it up in their mind that they're going to be committed to quitting smoking. They have to commit and want to quit smoking for it really to happen. So it's very much a mental decision.
The people that I've seen the most effective in stopping smoking is saying, okay, I'm quitting. You know, but it's a very addictive thing. It's very, very difficult on somebody. So we as physicians have to keep on people for that. Sedentary lifestyle, what does that mean?
Inactivity, not getting regular aerobic exercise. So most Americans are sedentary, meaning that they don't meet the goals that the American Heart Association sets for exercise, which is 150 minutes a week of moderate intensity exercise. So 30 minutes, 5 days a week of walking, or 75 minutes a week of intense exercise like running. But most Americans do not meet those guidelines for aerobic activity. And exercise has many health benefits. It lowers blood pressure naturally. It can help lower cholesterol. It can lower your blood sugar levels. In addition, it conditions your heart so that maybe it tolerates heart attacks better or heart disease better, and can even prevent it.
So 150 minutes, that's like 30 minutes, 5 days a week. What do you think about some of the technology, the Fitbit watches, or the watches that help encourage people to be active every day?
I think it's good to know how many steps you're taking and to know that you have been active throughout the day. But really, from a cardiovascular perspective, we want you to get dedicated aerobic activity. So 30 minutes a day of sustained aerobic activity, keeping your heart rate at an elevated level for 30 minutes a day is actually what's more beneficial.
So you have to walk fast, or you have to walk?
Walk with some,
some vigor to it.
Some intention.
Don't gaze and stop and look at the flowers.
Right.
But any type of activity is better than no activity.
Exactly.
What are some of the activities that the cardiologist likes?
We like aerobic activity, so walking, jogging, anything that will get your heart rate up to condition your heart.
What about bicycle riding? Is that good?
Cycling is very good, and it's actually very easy on your joints, so cycling is very good as well.
I know there's a guy, Kenneth Cooper was the first one to use the word aerobics, and he could tell what somebody's conditioning was going to be until one person stumped him. That was a person that he didn't recognize, was riding his bicycle to work and back. And he was physically fit as anybody that was in there. So exercise is very important. Get off the couch, get your tennis shoes, get with it, make it sustained activity.
Yes.
Though. That's very important facet. Anything else about women and heart disease and heart attacks and prevention that we should know?
So I think it's important for women to identify some of those risk factors that they cannot control. In particular, your family history. We know genetics plays a huge role in predicting whether or not you might develop heart disease later in life. So a family member, a female family member under the age of 65 that has had a heart attack or heart disease is considered a family history of premature heart disease. A man under the age of 55 who has had a heart attack or heart disease, that's premature heart disease. So those are those identify those patients that are at risk of having heart disease from a family history perspective.
So that's why we always ask, is there any diabetes in the family history, any heart disease in the family history?
Exactly.
Very, very important. What else?
So younger women during pregnancy who have a history of preeclampsia or high blood pressure with potential seizures during pregnancy. Pregnant women who have gestational diabetes. So gestational diabetes is being a diabetic during pregnancy. It might go away after pregnancy. Your blood pressure might be better after pregnancy, but those two populations are at a significant increased risk of having heart disease later in life.
There's a lot of importance understanding how we can prevent heart attacks, how we can recognize heart attack. It must be wonderful to be a cardiologist and to see patients that have the potential life-threatening and save their lives.
It is very rewarding, and what's very rewarding from a prevention standpoint is seeing and meeting those patients who recognize that they're at risk and having them come to you and ask for their advice about how they can reduce their risk, and being aggressive with blood pressure and cholesterol and staying active and living much longer, healthier lives than maybe their parents did.
Dr. Janet Eichholz, you are a wonderful teacher. I have enjoyed this show so very much, and it's so important to the viewers. Thank you for coming to the Dr.
Thank
Bob
you for
Show.
having me.
Wow, a lot of information. It's so important for you to know. Now you're going to want to stay tuned. We'll be talking about a new medicine available for depression after delivering a child and symptoms of too much blood sugar or too little blood sugar. They both got different symptoms. You'll want to stay tuned. I want to thank Dr. Janet Eichholz for a wonderful discussion on women and heart attacks and heart disease. Now, questions from you, the viewer, that I think will be important to your health. Dr. Bob, is there really such a thing as depression after pregnancy? Wow, that'd be a hot and dangerous question to ask a lady who's just had a baby, because they have all sorts of stresses. And during pregnancy, they feel great. They are hyperactive. They have lots of energy. They feel good. They're cleaning the house. They're doing things, and they're running a mile a minute. And that's because of the hormones of pregnancy are estrogen and progesterone. Now, progesterone levels fall dramatically when we have childbirth. And when that happens, all that get up and go goes, and we're in the dumps. We're down. We feel blue. We don't feel good. Not only that, but we don't get any sleep because babies do cry. We have to change diapers. We have tender breast mastitis. So women normally don't feel good for the first few days after pregnancy, but there's nothing like holding that precious, precious young child. What happens if those blues continue? What if they get more serious? What if even life doesn't seem to be worth it despite that beautiful child? What if you don't want to face the day? If you just can't get rid of the sadness? Well, that's postpartum depression. It occurs and it stays prolonged for 2 to 3 months until somebody recognizes it. A new medicine out that's available for treatment of that. It's an injection. And so with that injection, you'll be able to have good treatment available for postpartum depression. Talk to your doctor about it. It's approved in March of 2019 by the Food and Drug Administration. So be sure that you talk to your doctor about that new medicine if you're depressed after pregnancy. Question number 2. Dr. Bob, what are the signs of too high blood sugar and too low blood sugar? Well, high blood sugar is when their blood sugar goes higher and higher and higher and they don't know it. That's what happens with diabetes. When the blood sugar is real high, it tries to get out the kidneys, and when it goes out the kidneys, the sugar, it pulls water with it. When it pulls water, it takes out electrolytes. And so people get a higher and higher blood sugar if the kidney is overtaxed. And so those symptoms are the polyuria, urinating a lot, polydipsia, thirsty because you've urinated a lot, and polyphagia, you're eating like mad even though your blood sugar is too high. So if those 3 things are there, polyuria, polydipsia, polyphagia, be sure that you see your doctor. Do I have diabetes? If you take too much insulin, or if other reasons your blood sugar goes too low, we call that hypoglycemia. And that's where the body shakes, you sweat, you perspire, your pupils dilate, you feel jittery, you know something's going on, and it's satisfied by taking some quick-acting sugar. So that can happen if somebody is taking too much insulin for their diabetes, or if their medicines are too strong for type 2 diabetes, or other reasons that people can get as far as the liver goes where you have a low blood sugar. So if your blood sugar is low, be sure that you know your symptoms and can do something for that. And that's all the time that we have for this show. Remember those things that we want to talk about. Number 1 is exercise. We talked about that with Dr. Eichholz. Exercise is so important. It will decrease your blood pressure. It will decrease stress. It will make you feel better. It forms new collateral circulation in the heart, and especially that persistent exercise 150 minutes a week or 30 minutes 5 times a week. You need to get out and walk. Use a Fitbit watch. It'll encourage you to exercise. 7.5 hours sleep. How important that is. If we're not sleeping enough, we don't perform well. And if we don't perform well, then the people around us will recognize that we're a little bit irritable. Lack of sleep means irritability, not performing well, a foggy head, windshield wiper there that you have to clear out. And so be sure that you're getting your adequate sleep. If you're not getting good sleep, talk it over with your doctor. Is it pain that's keeping you from doing that? Is it just that you don't know how to go to sleep with a quiet room, warm covers, things quiet, drifting off, taking your time, preparing yourself to go to sleep? Eat properly. Eat breakfast, lunch, and supper. Make them small meals, breakfasts of fruit and fiber, and you'll find that you gain weight and that you'll feel better. And most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. Remember to laugh a lot. When you laugh a lot, your immune system will work better. You'll feel better. The people around you will feel better. And the laughter is so, so important. So find that person that you love, tell funny stories, laugh at each other, giggle a lot. And the more you giggle, the healthier you're going to be. So laugh a lot and stay healthy for Dr. Bob.